In the name of God, the compassionate, the merciful, before anything, please introduce yourself.
In the name of God, the compassionate, the merciful. In the name of God, indeed. The God who has a philosophy behind everything he pushes us toward. I am Zahra Sabahi. I have a BA in nursing. I used to be a supervisor at a hospital for many years. During my work experience, I caught all sorts of diseases. I had to retire prematurely because of those illnesses. Namely, the worst of all, which was lupus SLE. I had to take corticosterone for 4 years and a half. I also used methotrexate for chemotherapy, which messed up my whole system. I was asthmatic as well. I had to use an inhaler occasionally, particularly in cold seasons, when I caught a cold and I had to keep the inhaler in my purse all the time to help me breathe better. The infectious diseases specialist and the pulmonologist advised me to take the flu vaccine once a year at least. You know, people who are at risk have to take the flu vaccine every year, right? I also had to get the pneumococcal vaccine every few years in addition to that. I suffered from high blood pressure. My whole life was disrupted. My blood sugar was oscillating. Sometimes it would soar because of diabetes. I had to take insulin for a few years under the supervision of a specialist. Continuous headaches. I suffered from headaches 5 out of 7 days a week. I had terrible osseous rheumatism. I had cold, clammy skin. My whole life had become miserable. What else can I say?
Name the diseases again. What were they?
Lupus, high blood pressure, asthma, high blood sugar, which was oscillating. It kept spiking, then coming down. As I said, I had to get insulin shots for years under a specialist supervision.
Insulin?
Yes, my type 2 diabetes was very dangerous. I was still using insulin. I became pregnant while I was still diabetic. Fortunately, it ended well.
You had terrible headaches.
Nothing worked to relieve my splitting headaches at all. Sensitivity to light, it intensified my headaches. I was a real mess. I was riddled with illnesses.
When did you come to our center? What year was it?
I came here in 2012.
2012.
It was early 2012.
When you came here in 2012, did you still have all those problems?
I did, yes.
All those problems?
Actually, I tried everything. Since I was a nurse, I consulted with all sorts of specialists. All sorts. I talked to my colleagues about it.
Specialists and MDs?
Yes, I went to a rheumatologist. I went to 2 of... Do I mention their names?
Do not name names. It's better not to.
I went to 2 of the best rheumatologists in town. I also went to an endocrinologist for my diabetes. I went to a pulmonary specialist for my asthma. I went to other physicians for high blood sugar and high blood pressure as well.
An endocrinologist?
Yes, that's right. For my blood pressure, I saw a cardiologist. And because of my many illnesses...
Very well.
My workplace held a committee meeting and agreed that I should retire earlier than I was planning to.
So you took all types of medicine?
Yes, an awful lot. Just imagine, I consumed corticosterone every day, also the blood pressure drug, an inhaler all the time, as well as a methotrexate once a week, which is for chemotherapy. I had to get the flu shot every single year, along with that pneumococcal vaccine I mentioned earlier. Since my blood sugar was fluctuating, sometimes I needed insulin shots. Neither diet nor oral medicine worked on me at all. And gradually, the doctors said your diabetes is insulin-based. That's how bad it was.
When you came here to try traditional medicine, how did you feel deep down? Did you ever think traditional medicine would help?
I'd heard a few things about it, and I'd asked various doctors about it as well, but unfortunately, none of them believed in traditional medicine and how it works. But deep down, I did believe in it, and I felt that, well, I've already tried everything else without any luck, right? To quote my husband, it's a shot in the dark. Let's give it a shot as well. You never know, it might work. You are not going to get worse than you are now. Even if it doesn't work, I'm sure you're not going to get any worse, right? My life had come to a standstill. Just think about it. My children are dependent on their mother. My husband as well. We couldn't live a normal life. Every day I thought, oh Lord, what's it going to be like today? I had excruciating pain in my joints. I had edema, Go figure, my weight had gone up to 80 kilos. In the mornings, when I wanted to leave my bed and do the work around the house, I had to struggle for 2 or 3 hours in bed. It was such a struggle just to get out of bed. God knows sometimes I did it on all fours. I'd move on my hands and legs for a while just to warm up. Just imagine what I was going through. High blood pressure, those terrible headaches that would hit me in the back of my head. I thought it was a result of high blood pressure, and my husband would get out the gauge and say, yes, your blood pressure is high. It's very high.
As a nurse, after many years of undergoing modern medical treatments, how did you feel about them? I mean, you said the situation was getting worse by the day, right? They weren't getting any better.
No better.
How did you feel? The world of medicine with so many facilities and treatments couldn't help you.
You see, doctor...
But you came knocking on the door of traditional
Yes.
medicine, something that belongs in the past. We just read about it in books. You decided to try traditional medicine. As a nurse, a veteran nurse, what do you think?
Let me tell you this, doctor. I really didn't... They told me my disease, SLE, was incurable. My insurance plan has defined it as an incurable disease. I knocked on every door hoping to find a treatment that would help me get better or at least contain the progress of my illness, but I was told, quit the search, that's it. Come to terms with it.
Of course, they are incurable, considered incurable by modern
Yes, it's incurable.
medicine.
As I said, my insurance company defines it as incurable in the same category as cancer and other incurable diseases. It means it defies cure. So I had completely lost faith in modern medicine, completely. I was getting worse by the day, but I had a ray of hope in my heart. As I said, no one took it seriously. No one believed anything good would come out of traditional medicine. For example, when I told others I was going to try traditional medicine because my husband had heard it worked, and because I had checked out your website and read what you'd posted there and so on, I think it was an act of God for my husband to attend a conference that you were also present in, and then encourage me to come here and see you, and he brought me here himself. All that was the work of divine providence, really. I'd gotten to a point where I could feel a gradual death coming upon me. I was dying slowly. Sometimes I thought to myself, when someone dies in an accident, it happens in an instant. Everything ends in a moment. But I am experiencing a gradual death. Just imagine your headache is so severe, you can't get anything done. Nothing at all. When someone wants to speak to you, you get angry with them. You want to yell at them, although they're in the right. I was the one losing my patience. Why? Because I'd lost the battle against my diseases. I was under attack by all kinds of diseases. I didn't have any choice, but I kind of believed in traditional medicine already because I remember my grandmother and my great-grandmother would give me something to eat or drink and say, this is going to make you better.
Folk medicine, you mean?
Yes, folk medicine. Things they knew. For instance, I remember her saying, licorice is good for your stomach, take it. Or, darling, why do you use so much vegetable oil in your food? You'll get ill. Why do you eat frozen meat? You're going to get ill. Well, given our circumstances, living in a city, our job situation, we have to live like that. We have no choice. The fact is, we're not living. We're just alive. But then I came here, and I came into your office, and I got this positive energy from this place, and it filled me with a lot of positive energy.
Let me say this. When I first met you, what really upset me was the fact that you were a nurse.
Yes.
You'd spent years providing care to patients who really needed your help, and with your vivacious personality, you must have been a terrific nurse. But you've arrived at a point where, according to modern medicine, you needed some serious nursing yourself. I mean, you had to take care of yourself and also continue with your treatment. The treatments that you underwent, despite the fact that none of them cured any of your diseases, did they have any side effects? For instance, the tests you had to have run on your liver or on different parts of your body, were those side effects evident in your clinical symptoms? What were they?
One of those clinical symptoms was the headaches that I started having, a prescription drug side effect.
Drug-related?
Nothing can be done, they said.
You mean you started having headaches after you took the drugs?
Yes, that's how they started. And my test results wouldn't change at all. I mean, although I was on all kinds of medication, I still had the same disorders.
Okay, but did those tests find any drug-related side effects?
No, the side effects were
For
mostly
instance,
clinical.
liver
No,
problems or
mostly
things like
clinical.
that?
They were mostly clinical. I'd notice them myself. Then I'd go and see the doctors, and I would read the brochures, and I'd say I have such and such symptoms. And they both said they're the side effects of medicine. I suffered mostly because I had more information than ordinary people did, so I had more stress than them.
Very well. Now, let's talk about traditional medicine. When you came over here, when you came to our center,
Yes.
well, we started with you in 2012, right?
Yes.
From the time we started in 2012 till you felt any improvement, what did you go through? I'd really appreciate a detailed account.
Well, when I came to see you, right at the outset you found out what my temperament was, which is phlegmatic, and then you said I had to remove cold foods from my diet altogether. You put me on a new diet. Then you gave me herbal medicine, and I followed your orders meticulously. Since then, I have tried as much as possible to keep cold foods out of my diet entirely. You put me on a diet. You told me how to cook my food, what type of meat to eat, what kind of oil to use, how it should be cooked, when the medicine had to be taken. You also said that cupping therapy was just the right treatment for someone like me. You even trained my husband how to do it. We did the cupping therapy every other night. And the times you set for cupping therapy and leech therapy, I came in on time and did all of them. All those things worked together, and gradually I felt so much better. And then I think it was the second time I came to see you, you told me, throw away methotrexate once and for all. Don't take it anymore. To be honest, I wasn't sure, should I or shouldn't I throw it away? But like I said, deep down I believed in you, because soon after I came to see you, about 3 or 4 days later, I felt a little better. The weight that I felt inside me and the lethargy that I had started to go away little by little. That was when I said to myself, you either have to run with the hare or hunt with the hounds. You must believe in this treatment and go the whole hog. I didn't achieve anything with modern medicine, did I? I only got worse, so let's try this treatment. It can't get any worse than it is. You stopped me taking methotrexate and reduced my corticosterone intake gradually. It got to a point where you told me to quit taking corticosterone altogether. I mean, after doing 4 or 5 cupping and leech therapy sessions and taking herbal medicine you gave me, I got to a point where you said, now is the time, I want you to stop taking corticosterone altogether. To be honest, I had my doubts. Should I or shouldn't I do this? I was on the horns of a dilemma. I asked you, how about I have a test? You said, do it. Nothing wrong with that. I hadn't done tests such as CT, C4 anti-DNA and similar tests for a long time. I had a thorough checkup from my glucose to DSR, ESR and CBC and the specialist rheumatology tests. I got the test results and I went and I spoke with the lab doctor himself, that I was a nurse and I had gone there from Tehran and that I was under traditional medicine treatment. Since you are sending the test somewhere else, if it's possible, please do it yourself for me. I want to be sure the tests are done correctly and the results are accurate. They did it and said, there's nothing wrong with you. There's nothing wrong with you. Then I brought the test results to you and you said, thank God. After that, my husband had to go on a business trip right at that time, and truth be told, I was in 2 minds about giving up corticosterone altogether. Just to be sure, I went to see my doctor one more time. When the doctor saw the test results...
And you said that doctor is a rheumatologist in Tehran.
Yes, a rheumatologist. In fact, he is, the head of the rheumatology department in one of the medical centers in Tehran. In Tehran. When I arrived in Tehran in the morning, I went to see him immediately at the hospital clinic and showed him my test results. Because I'd worked with him in the past, he knew me and he let me in immediately. When he saw the results, he said, there might have been a mistake. These can't be your results. So he called a lab in Gisha Street. The doctor was a friend of his. He talked to him on the phone and he said, I'm sending a lady to you. I know the tests take a couple of days to run, but I want the results this afternoon. I got the test results in the afternoon and took them to the doctor's office, and when he saw them, he said, I have no doubt there's been a miracle. I can't buy it that you have stopped taking your medicine, that you're not taking methotrexate anymore, but your disease has been contained. My glucose was low, my blood pressure had gone down without medication. As for asthma, well, I haven't had to use an inhaler since 2012 when I came to you. And as for corticosterone, I haven't taken any since 2013. As a matter of fact, it's been 2 years since I did those tests in May 2013. And since then, I haven't taken anything. Nothing.
And the headaches just went away.
And the headaches just went away, just disappeared forever. Although I've had to deal with very serious emotional upheavals and endured a lot of stress since then, but fortunately, none of them have had a physical effect on me that may have led to my illness reoccurring or all those other problems coming back again.
So when you turned to traditional medicine, You change your lifestyle too.
Exactly.
That means you change your nutrition.
Exactly, yes.
Your diet. I think you've been
Yes,
exercising too.
yes.
Cupping itself is
Yes.
a type of massage. It's an
Yes.
invaluable practice. You took herbal medicine as well. For me, it was an important project. I mean,
Yes.
of course, just like psoriasis and
yes.
other diseases, this one too is a serious case. And gradually, when I saw you were getting better, I actually prided myself on it. But the fact that you are a nurse and understand what you're told very well, gradually you did the tests and the results came out better every time.
Yes.
And the clinical symptoms,
Yes.
well, you're a nurse, right? I mean, there are times you're talking to someone who isn't
Yeah.
an expert. Comes out and says, "Doctor, I feel better. I've recovered, doctor," or things like that. But when a nurse talks about it, they can't be fooling themselves.
Yes.
So things got better and better as time went on. Since 2002 till now, it's been almost
Yes.
4 years. It's been almost 4 years. In this 4-year process, there was a time when you were in a kind of what could best be described as limbo, so to speak.
Yes. It was hell, doctor. It was hell, doctor, not limbo.
You didn't know whether you would or wouldn't
No, I
be
literally
cured.
went through hell. Let me put it this way. Imagine you are an active, hard-working person. Active. Sometimes I worked 2 shifts in a row. I worked really hard, especially after the war. I spent years playing nurse to those wounded in battle. I considered myself a very helpful person. I spent years working in the infants department to help babies born prematurely or those with serious vital problems. I attended to their needs and helped them get better. I mean, it's not right to sing one's own praises, but I was extraordinarily hardworking and positive. But I got to a point where I felt handicapped. I was handicapped. I couldn't even get up in the morning and go to work. And when I did get to my workplace, I couldn't fulfill my duties. Why? Because all my illnesses would come rushing back. I was at the end of my tether. I kept thinking why someone so active and so positive, did so much work and so many tasks, can't even handle her own personal chores anymore. I mean, I couldn't even carry out my house chores and other family matters anymore. If it weren't for my husband and my children's support, I would have given up on getting better a long time ago. I would no doubt have become depressed. But as I say, my family supported me every step of the way, and I must say my husband in particular. I mean, he was the one who brought me here to try traditional medicine, and he was the one who had my back all the way. I don't think I can ever make it up to him for his support. I'm also grateful to God, who somehow had you show up along the way, steering me in your direction and sent me here to your office. I think God willed for all that to happen. I mean, if none of this had happened, if I didn't come to meet you, I might have ended up in a much worse situation.
It's been 4 years since you came here, experienced traditional medicine. Fortunately, it's been
Yes.
4 years now. I've seen you get far better. Your temperament
Yes.
has improved. You look livelier. It really
Thank you.
gladdens my heart. Anyhow, in medical science, we say regression is always possible, but in your
Yes,
case, there's
I
been no
appreciate
regression.
that.
Quite the contrary. Your health has been improving
Yes,
by the
thank
day.
you.
I'd like us to talk about that now. The fact that traditional medicine has always been God Almighty's. He is the great healer. We're just instruments. Nothing we have
yes,
is
but
our
God
own.
has to
yes?
want for the instrument, to produce
God has given me this
results.
honor. Believe me or not, when a patient with an incurable disease regains their health like this, there's nothing more gratifying than that.
That's right.
I mean, you feel like you've been born again. It's such a great feeling. What I want to know is, well, when you turned to traditional medicine, little by little, all your clinical symptoms started to disappear. You had almost 5 types of serious illnesses, 3 or 4 of which were incurable, and one of
Yes.
them a side effect of medication.
Yes.
All those diseases left your body over the course of time. How did that change your beliefs, your attitude towards work, towards science altogether? For many years, modern medical science has made great advancements and continues to save many lives.
That's right.
I mean, we're not saying modern medicine is always full of flaws or anything. No,
Correct.
it is saving lives. As a nurse, you've helped people, the different doctors too. The likes of that specialist, they're all saving lives. But the fact is, it didn't work in your case. And our textbooks say clearly there is no cure for it. There's no cure for this illness. And they say it honestly what the side effects are, as we read in the brochures
Yes.
and textbooks. They say unequivocally that this drug has these side effects and this illness has no cure, and that you have to be on medication for the rest of your life. But despite those circumstances, you turn to medicine that prescribed herbal medicine, used traditional methods. Apart from that, every medicine that was prescribed was sent down by God. We were just instruments merely managing the situation for things to get better. How did that change your beliefs about science as a nurse? Because after all, you were prescribed
Yes.
herbal medicine. If we stopped the corticosterone,
Yes.
we had an alternative for it. Otherwise, you
Yes.
remember, it took some time to get
Yes.
you off corticosterone. I'm a doctor. I can't stop corticosterone suddenly. Methotrexate is a different
Yes.
story. There is a reason why we stop a drug immediately, but you
Yes.
can't do that with corticosterone. You've been through it all. I'd like to hear your scientific, spiritual, and conceptual conclusion about what you have actually undergone, please.
It really upsets me to see some people reject something they have no knowledge of outright, you know. They just announce it. For instance, many of our physicians who are no doubt educated in modern medicine and have done their homework and deserve our respect, yes. And they've saved a lot of people, as you say. But why do some reject an entire science that they don't know anything about? It shouldn't be like that. When people like me regain their health and are cured, the message is that there must be something in this science that gives results. Not only should this science not be rejected, in my opinion, it should be promoted at university level. There must be branches in other places to promote this science in society. I think we have all these problems because we have ignored traditional medicine. It's a very basic and simple science. It says you have to change your lifestyle. Our lifestyles are wrong, and most of our diseases originate from those wrong lifestyles. When it comes to eating, to sleeping, everything we do. If we were to draw a comparison in the past, at the time of Avicenna and other physicians, we were the best in medicine. Why? Because they practiced traditional medicine and herbal medication. Right now, European and American countries are applying traditional medicines. They are making the most of it, but they're selling their chemical drugs to us, for us to use. I think traditional medicine should not only not be refused, Doctor, it ought to be applied side by side with modern medicines. They ought to work together. They need to cooperate with each other. I even think universities should add a course by the same name to their curriculum, and everyone, physicians and nurses alike, all those who are working with hospitals should pass that course. When I walk out into the natural world, I have to know what that certain plant is, what it is good for. After what you taught me and because of the things I've learnt on my own, I became a firm believer in herbal medicine. Whoever tells me they have a health problem, I say traditional medicine. Because I have seen the miracle in my own life, and my family have seen the miracles as well. Now, when my children want to eat their meals, they ask me, Mom, is this compatible with that? Isn't it? I won't eat it if they aren't compatible. So when we can, easily, very easily, without ending up in any trouble and without having to spend any money, apply traditional medicine to all areas of our life, why shouldn't we? And if someone who, studied nursing in Tehran, who worked in Tehran, wherever it came up, they'd say, no, he's old, he doesn't know anything. When you tell them to give their children the Caspian manna, I'll never forget this. We had this physician who was doing his national service there. He had specialized in pediatrics. He had been assigned to work with us in our medical center. Every infant they brought to him, without exception, he'd say, give it lots of Caspian manna. We all witnessed the miracle of Caspian manna right there. I saw it with my own eyes. But some of the other doctors, they begged to differ. They said, come on, he can't be right. He was just shooting off the hip. That's why he firmly believed in what he was doing. He would say, I believe in it. And we'd see the result of his beliefs in the tests we did on the infants. I witnessed the results on the infants.
You believe in it now?
Yes, I do. From a scientific standpoint, no, it wasn't scientific.
Tell me about that
Yes.
aspect.
Scientifically, they'd say no. If the mother wants to give it to her child, she has to do it secretly so other people won't see. Why? Because they'll laugh at her. Scientifically speaking, I believe we must know the doses of medical herbs. Their clinical doses must be ascertained. We have to train people in this field. They should learn the science of it. Our nurses and our physicians. Doesn't make any difference. Even I myself, already a nurse, if I were to study nursing right now, I'd have to study traditional medicine.
Actually, we did the same thing, meaning we gave you those medical herbs according to their effective qualities and the humor in them.
Yes.
That's what happened. What's interesting is modern medicine helped us in this regard.
Yes.
I mean, modern medicine helped
Yes.
us run those tests. It was teamwork. It was good cooperation.
Yes, that's why I say that they have to work together.
Yes, and we are.
They shouldn't work separately, should they? They
Exactly.
should work in tandem, in parallel to
That
each
day,
other.
the day when you came here and said a rheumatologist colleague had called it a miracle,
Yes.
it was a pat on the back for me. It was music to my ears. At any rate, perhaps as my final request, I'd like you to talk about the ideological aspect of it all. and the power of God. That's what I'd like us to talk about and wrap it up. I'd like you to say, and you can put it in any way you like, I leave it up to
You're
you.
very kind.
Say it in your own eloquent style. Where does God fit in all this? I mean, we are just instruments. I mean, without God's will, it's impossible for us to treat all those different diseases out there. Please say a few things about that, and we're going to leave it there.
Well, speaking of God Almighty, well, it's true that God gave me all these diseases. I was never ungrateful. I always thought maybe this is a test. And it really was. I still believe it's a test. Just as he gave me those diseases, he put you on my path and helped me get to know traditional medicine. That ray of hope that was kindled in my heart, as I say, I didn't think something like that would happen, not even in my wildest dreams. I was beginning to lose all hope of getting well. I'd say there are so many other people, I can see them, I can see what lupus can do to you. All these other people I'm talking to about it, I can't fool myself, can I? In the long run, I'm going to have the same complications, aren't I? So I have to get ready for them. But again, I'd say, my Lord, you've given me these illnesses, you have given me this disease. I want a glimmer of hope, no matter where it comes from. Coming here and seeing you, coming into your office and getting to know you. I mean, that bizarre incident that unfolded, my husband went to that conference and just by sheer coincidence met you there. It was all God's work. It was all God's doing. And because my complications got mitigated after seeing you a couple of times, my husband got himself relocated here from Tehran altogether. Because he didn't want me to go back and forth between the two cities and get tired, or for himself to get tired. He'd say, I might end up nagging you, or something might happen to prevent me from driving you here every week. And you might give up your treatment, drop it altogether. No way. Do it. As much as he could, he gave me positive energy. And whenever I came to see you, you gave me more hope by saying things like, thank God you're getting better. What are the symptoms like? You look much better. That's exactly how it was. It wasn't pretense. It was sheer truth.
Okay, thank you very much. Now, let's wrap it up, huh? A few important diseases. Lupus, hypertension, asthma, and most important of all, diabetes, which led you to getting insulin shots that had side effects such as headaches that had disrupted your whole life. With proper management on the part of your husband, for instance, first of all, you had God on your side.
Yes, God.
Who determines what should and shouldn't happen. Your husband, who got himself relocated because of you, and came to live here. He started working in the city of Esfarayan. Your children, your own energy, your own unshakable faith in God, and the effect traditional medicine had on you through me.
And your presence, Doctor.
And God knows, I mean, when I was treating you, well, there is no shortage of lupus sufferers, is there? A large number of them came here and their treatments were successful. What's very interesting is when it's done in the form of a project, the family, the doctor, first of all, God's kindness. Then family, the doctor, the herbal medicine, hijamat, leech therapy, all those things work hand in hand to make it happen so you can live with your family in peace today. And to strengthen your belief in this medicine much more than before. We too are very happy. Anyway, I'd like to thank you for participating in this interview. Let me ask a blunt question.
This is the least I could have done for you, Doctor, to thank you
God
for what
bless
you did
you.
for me.
This interview is valuable for several reasons. First, because you are a nurse. You're an experienced and knowledgeable nurse, in fact. This is very important. Second, because you're very eloquent. You speak well. And third, because you used to have some serious diseases that are no longer there. A diabetic who used to get insulin shots doesn't get any medication now, and her blood sugar is completely under control. She has no problem at all. You had asthma, used inhalers, corticosterone, and so on. Been taken off all of them, can breathe normally. You had lupus, it's gone. Hypertension, all gone. This is a very big thing that God has done, and that's what He always does. What God does is never trivial. That's why I'm so very happy. And let me ask you a blunt question. Am I allowed to release this interview?
Yes, sir.
Are you okay with it?
I haven't done anything to return your kindness, Doctor.
It's been a pleasure.
It's true. God comes first, and I'm just an instrument. I really think you are a godsend for me. The health that I'm enjoying now, I owe it to you and your colleagues' efforts. Especially you, sir. And you are so attentive. You've always given me positive vibes, motivated me to come back again and again. I mean, every time I came to your office, I made sure I'd come back for my next appointment with no delay. Because you gave me positive energy. The things you advised me to do, I really saw them produce results. It wasn't just the medical treatment. You also treated me spiritually and psychologically. I mean, it came in the shape of things like hijamat, leech therapy, or
herbs.
Yes, medical plants. What takes precedence over all those is the good vibes you give off and the positive attitude you have. Because you see, when you walk into a doctor's office, you know, it's very important how the physician treats you. You see doctors who, I'm sorry to say, I mean, I really don't want to insult anyone, but unfortunately some doctors out there, I don't know why, but a patient goes into their office and they treat them like an object, a lifeless object. They just want to get the job done. Whereas the psychological aspect of it, like speaking with the patient, which takes priority, listening to them patiently, hearing out the patient's complaints, sympathizing with them. Of course, you can never really understand how a patient feels if you don't have that disease yourself, right? You really can't. But when you tell them it's going to be okay and you respect how your patient feels, it's worth a lot. And I really, like I said, cannot compensate for what you have done for me. Before anything, I'm grateful to God, and for you, I pray to God to keep you, your wife, and your children in good health forever. I hope you yourself, your family, and your whole progeny, all of you, will be immune to all diseases. Because when you return my health to me, you relieve my 2 daughters and my husband's concerns and sorrows. Of course, my father, too, may God bless his soul, has passed away
May he
a
rest
few
in
months
peace.
ago. But it was the same for him as well. My disease was his main preoccupation. He'd always tell me, my darling, I have to personally thank the doctor that has cured you, and kiss him on the hands and feet. I swear to God, those were his
May God
exact
bless
words.
his soul.
But he didn't live long enough. But what I keep going back to is that I, as a university graduate, as someone who studied nursing and interacted with lots of patients and knew exactly what my disease was, I comprehended it. Not that the first time I went to see an endocrinologist to treat my diabetes, the doctor told me, according to your test results, your hemoglobin A1C and so on, there's nothing that we can do for you, really. You have to take insulin injections. I said, okay, doctor, prescribe it, I will do it. He said, you are the first patient who did not negotiate with me. Why, I asked. He said, because every patient who comes to me tries to negotiate. Doctor, can I please not take insulin shots? Can I do this? Can I do that? I said, well, I'm a nurse myself. I know there is no other way than this. There's nothing you can do. You either do it and hope for it to be contained and to mitigate your illness, or suffer the consequences of not doing it. When I first set foot in your office, like I said, I had a ray of hope in my heart, which was given to me by God. It was 50-50. When I saw you, I was 100% sure right then, and felt it in my heart, in my mind, and in my body right then and there. Right now, if anyone tells me they have a health problem, without exception, I tell them, go see a traditional medicine physician. They can help you. If they live near here, I recommend you. And if they live elsewhere in a faraway city, I tell them, go to the closest center. It won't be in vain. And they got results.
God bless you.
Thank you very much.
Final sentence. I'll say it if you allow me.
Go ahead.
This must have been tiring for you.
Not
indeed.
at all. I have received so much energy from you, Doctor. If you allow me, I will
appreciate
keep on
that.
talking till sunrise
I
tomorrow.
wish you lots of
honestly.
luck.
Thank you for your kindness. Thanks indeed, sir.
I hope God Almighty will cure all patients.
Amen to that.
I hope no one is taken ill. No one comes down with
Amen.
incurable diseases. Thank you very much. Now, one more sentence. I want you to say the final words and wrap it up. Final comment. Say whatever you like.
I'm just a simple, sinful human being created by God, that's all. Now, I don't know. Maybe I did something good at some point in my career. There must have been something, in my opinion, nothing we do is hidden from God. He sees everything, everything. I suppose I did someone a good turn sometime, and that's why he directed me towards traditional medicine and to you. I am certain about that now. I ran into a doctor I knew after many years, and he told me. He said, Mrs. Sabohi, you seem to have gotten much better. I told him, Doctor, you do not know. I am very well indeed. He said, can I tell you something? I said, go ahead. He said, when I was a doctor and the head of the department, you'd stay behind at the hospital after your work hours were over. And no one could find veins on the premature babies. And you were the one that would help them with that. And because you live near the hospital and they call you at night sometimes, and you would come and find their veins, Hazrat Abbas cured you. That's exactly what he told me. I asked him, how do you know that, doctor? I won't name him. I wish him health wherever he is. I asked him, how do you know? And he said, God be my witness. I'll never forget the day. There was this child who was very dear to his family and needed help. They called you at home at midnight and you came to the hospital and helped find the right vein on that kid, and the drug injected through that vein saved the kid's life. I don't want anyone to forget this. He told some of my colleagues about it. He said, if it weren't for Mrs. Saboy's help, we'd have lost this kid once and for all. And I'm sure the prayers of not only that kid's family, but all of the other patients that you helped are the reason behind your newfound health. And I'm very grateful to God for that. I didn't do anything special for any patient. And if I did, God had me do it. But I am certain it was God who introduced me to traditional medicine, to Dr. Hajtalebi and this medical center. I will forever owe my health to you and your center, sir.
What a beautiful ending. Indeed, a nurse, thanks to your good nursing practice, because you have taken care of your patients with no strings attached, and because of your faith in God, the prayers of your patients have helped you regain your health. Thank you very much.
Thank you, sir.
I'm not going to take more of your time.
Thank you.
I wish you and your family health
you.
and well-being.
I tried very hard not to cry during the interview, because
Thank you
I've
very
been
much.
touched to my very core, and I hope I'm always grateful for what I have, sir. Thank you very much, sir.
Good luck.
Thank you so much.
I wish you health.
Thank
Nice talking to you.